It is 1:30, all right. Are we ready?
We're ready.
It's 1:30 on February 8th, and we'll call the Health and Human Services Board to order. We'll begin with the Pledge of Allegiance. I better get out of the way. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Good afternoon, everyone.
Good afternoon.
So, as we are moving into further into 2021
I
here.
know, can't believe it.
I'm hoping we're banking. I'll make a political statement where I don't want to see any legislation that makes these things lifetime mandatory.
Yeah, I no kidding. Somebody actually said they're looking at maybe 7 years. It's like, seriously?
Oh my gosh.
There might be an uprising.
Wow.
I'm strongly opposed to that. But on the agenda, though, we'll back to that. We'll begin with dispensing the minutes from the January Health and Human Services Boarding.
I'll move the minutes from.
I'll second.
We have a motion by Commissioner Hewson, second by Commissioner Wetter. Any further discussion? Hearing none, all in favor say aye.
Aye.
Opposed, same sign. All right, the minutes are approved. Today's agenda is...
Aye.
Oh,
Roll call.
that's right, roll call, I forgot we have...
I did that like every once in a while last
All right, so we guess we have to do roll call vote. Commissioner Dahlheiden.
Aye.
Catchmark.
Catchmark votes aye.
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 All right, minutes are approved. Now the agenda. Is there anybody who'd like to modify today's agenda?
Yeah, no changes.
All right, I'll entertain a motion.
I'll move the agenda for
Motion by
today.
Commissioner Hewson,
Second.
second by Commissioner Catchmark. Any further discussion? Hearing none. A roll call vote. Commissioner Dahlheiden.
Aye.
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 Agenda is approved. Today's consent agenda. Is there anything that needs to be pulled for further discussion for today's consent agenda?
Commissioner Vetch, I just wanted to mention that on our participants that are virtual today, we do have Eric from True Friends at the item 4A, to authorize the letter in support of True Friends to open a new day training and habilitation, DTNH facility in Annandale. So he's in attendance, so in case you have any questions.
Yeah, Mr. Chair, I would request that we pull that item, and that would give him an opportunity, and then I have a question.
Sure. We have a motion to approve today's consent agenda with the removal of item A.
I'll second it.
Second by Commissioner Dahlheiden. Any further discussion? Hearing none. Commissioner Dahlheiden?
Aye.
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 The consent agenda is approved. We will now discuss item A, authorizing a letter in support to True Friends to open a new day training and habilitation DT and H facility in Annandale. I guess I will turn over to Eric.
Eric Sage. So Eric is with us today, I understand. So Eric, in case you want to just provide the commissioners with any background regarding the request.
Yeah, thanks everyone. Can you hear me okay?
Yes, we can.
Perfect.
Great, thank you. So True Friends is a home and community-based provider in Annandale, Minnesota. We provide respite services at our locations to individuals with intellectual, physical, and disability, developmental disabilities. And what we would like to do is to expand our opportunity to serve individuals with disabilities in a day training and habilitation service at our Camp Friendship location in Wright County. And in the needs determination application, you'll see that we requested to serve up to 20 individuals at that location. We have a very unique space, and we have several opportunities for individuals to come to our location. It would allow us to serve individuals who are living at home with their parents and individuals who are currently receiving long-term services. And then just to provide more opportunities for them to make an informed choice about where they would like to receive these services. And that's something that we think that we could do at Camp Friendship.
Very nice. Commissioner Hewson.
Yeah, Mr. Chair, Eric, so this would not be at the Camp Courage site, it would be at the Camp Friendship site.
This would be at Camp Friendship in Annandale.
Yep, okay.
I believe that we, would like to continue to evaluate the use of our sites and potentially expand this service in the future, but don't want to get ahead of ourselves by trying to take on too much during obviously such a unique time in our lives with the pandemic. So I could see this potentially expanding to Camp Courage as well.
Thank you. Mr. Chair, I do have another
Yes,
question.
Mr. Newsom.
So I had a brief discussion with Jamie on this and wondering, this would be kind of to complement the services that are provided at Functional Industries. And I have not talked to Rod, but I think that you had reached out to Rod to ask.
Commissioner Houston, I did talk to Rod. I would say that they would be in competition. So when you say complement, I would say potentially it could complement services, but they really are the same services being delivered. So if you'll see in our letter, we say on the second paragraph, although the demand for DT&H services is currently able to be filled by our existing option providers, adding a new facility would provide more options for our residents in Wright County. So when I discussed it with Rod, they're down quite a few DT&H clients right now. They're hoping to fill that up again post-pandemic. What we feel True Friends would be offering here is a option, and as you know, DHS is very concerned that clients have options and have choice in their daily living experiences. Jill Pooler is also here, and she's had more contact with Eric. I've actually not had contact with Eric, but I'm very happy that Camp Courage and Camp Friendship is looking at, I believe they're looking at this potentially as a continuation of services. So if they're serving other clients, potentially this would be a way for them to complement their continuation of services to their existing clients as well.
I think the market, if it wasn't what it is right now, there is enough capacity for both. And especially, I think, location. I look at it, right now we're funneling a large amount of our population to a single location. In some of them, it's a substantial distance. And if we can offer people options closer to home for them, that is ideal. So I don't look at it as, we don't want to have monopolize the market for this type of service.
Functional Industries did close their Cokato DT&H facility at the beginning or sometime mid-pandemic, and brought those clients to Buffalo, the ones that were willing to do that traveling. And also, I believe the functional industry capacity is over 200, so a very different capacity level.
Mr. Chair?
Yes, Commissioner Dolan.
Yeah, Rise Incorporated, how do they differ from this organization?
Is that a question for, well, Jill can maybe answer that, or maybe Eric does, I'm not sure.
What all services RISE provides, but they're also not in the county. Part of this is expanding our options within our county limits for folks for DT&H.
So Commissioner DeLayden, it sounds like RISE does not have a facility in Wright County, so there potentially could be Wright County residents that go to RISE, but they're not, the facility is not in Wright County.
Okay, I thought there, for some reason there was one in the county. So, okay.
ATHC serves some of the Southern County, doesn't it, as well?
They're outside, I think they're in, they have a hutch.
They're in that hutch, but they do service, I think, clients in like Cokato and stuff that are on that south end.
Sorry, Commissioner, I did ask about that, and it sounds like it's only on a case-by-case exception to the rule kind of a basis when they go across county.
Okay.
All right, Chair.
Yes.
One question is this limited to Wright County residents, this proposed facility, or how is that determined who qualifies?
No, I believe, Eric, that this would be open to potentially people in Stearns County, which they would sit right on the border of Stearns County as well. So they would be serving clients that would cross county boundaries.
Okay.
It's just that it's our requirement to provide a letter if we feel like support is, the action that we should take, because then they would provide our county letter of support, which the board chair would sign in with their application to DHS. So it's kind of checking off the boxes of the requirements for their license to go through.
Now, is there any kind of scenario where I'm sure there's quasi-complicated screening process to figure out if this is right? Is there like emergency positions if need be, after hours, weekends, where somebody comes across somebody that could use this referral, but may not be the best to wait for the full-length process? Is there any kind of, for lack of a better word, beds per se that would be reserved for emergency situations in Wright County?
I don't believe that would be part of this service.
Okay.
This, just for clarification, like this type of service is people that basically go to mentally and physically challenged individuals that work through a mentorship program and get them basically out of their home and into the workplace and getting occupational therapy on the job. So basically, it increases their quality of life as well as allows them to build skills. So that's kind of what this type of treatment is. It's
Like functional
like
independence.
exactly. Yep.
Okay.
Yeah, day training, the service is, well anyhow, it has the legal authority, definition and overview, covered services. So eligibility would be are 18 years or older, are diagnosed with a developmental disability or a related condition, are not special education public school students, have received either a mid-choice assessment, which is where our agency steps in, or developmental disability screening, and have DT&H services indicated in their CSSP, which is some type of community service plan, I believe. So that's the population that this service would be targeting.
Eric, I'm just assuming that you're going to be doing most of your DT&H on location and not actually bringing clients into the workplace in the community, I'm assuming, but just curious.
Correct. Can you hear me? I can't see myself on the screen, so I just want to confirm.
See you and hear you.
Great. Yes, we would be trying to maximize the use of our Camp Friendship location in using our own facilities and positions that may exist within that location to maximize the opportunity for the individual receiving services.
Okay, thank you.
Yep.
All right, I will entertain a motion for a letter of support to the True Friends for a new day training facility.
I will make that motion.
Motion by Commissioner Hewsome.
I'll second.
All right, second by Commissioner Wetter. If there's comments, I just want to say it's always good to have options to people in the community, so this is well received. So with that, is there any further discussion? Hearing none, roll call vote. Commissioner?
Aye.
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 All right, we're good.
I'll provide the letter of support to
Thank
the
you.
chair.
Now, the fun part of our Health and Human Services meeting is to meet our new hires. Looks like we only have one today, which is a rarity.
Yeah,
but
sorry to disappoint, we only have one new hire, but she's a good one. So, board, I would like to introduce Sarah Hammer or Hamer? Your Hammer, I got both wrong. Sarah is a new employee as of January 15th. She's a case aide on our healthcare team, and she is going to approach the camera. Keep going, Sarah, so Commissioner DeLayden can see her as well.
Yep.
So I believe, Sarah, if you could let us know a little bit about yourself, where you live and where you worked before here.
So my name is Sarah Deerhammer. Previous to here, I've been in the group home world. So what you're just discussing, I'm very familiar. The last 15 years.
Oh.
So kind of everything from working the floor as a direct support professional to the director role. I kind of was in all of it for quite a while. And then had my son 2 years ago. I started super late and decided to kind of try something else. So I got very lucky in getting a position here at Wright County.
Wonderful. Good. So, do you live here in Wright County or?
I don't. So I'm in Zimmerman.
Zimmerman,
I'm
okay.
sure.
Not too far away.
Yeah, my daycare is in St. Michael.
Okay.
So it actually works out really.
All right. Well, you do use an employer then in Wright County.
Yes. Most of my funding.
Yeah.
And commissioners, this was a position, if you recall, at the very beginning of the pandemic, and the board had asked that we hold any vacant positions and kind of evaluate them in light of the pandemic and the changes that we were seeing at the time. So this position has actually been open that entire time. We went back and we asked for permission to hire, and we're very excited, and we'll be talking more later in today's meeting about our integrated services approach, which Sarah will be instrumental in. So we're very strategic in holding this case aid position for all these months and then bringing Sarah in with the background that she has.
Good.
Well, welcome part of the
Yeah,
team,
yeah,
Sarah.
welcome. Thanks for joining us from Wright County.
Yeah, welcome to the Wright County. Just too bad you don't live there.
She'll want to move here by the time she's been working here for a little bit.
Especially after some snowy drives down
Exactly,
the
yeah.
wildlife refuge.
It was a nice break in there. Was it Friday?
Yeah.
Thursday, actually. It was. Yeah.
Yes, it was.
We plow our roads better here in Wright County.
You did. From Zimmerman to Elk River, it wasn't so pretty.
Yeah. Yeah, I found that out.
Yeah, certain roads are.
Well, thank you, Sarah.
Thank you, Sarah.
Employee of the month for March.
Yes, board, I would like to introduce you to Jessica Luttrell. So Jessica, if you could turn your camera on, please.
Hello.
I'm sure we'll see you shortly here. So Jessica, there she is our March 2021 Employee of the Month. Jessica completed a social work internship with the agency in 2016, so she started as an intern. She was then hired as a children's mental health social worker in July 2017, so obviously we were happy with her intern work. During the year 2018 to 2019 school year, Jessica continued to work full-time at the agency as a social worker while also completing an internship with the therapeutic services team for her Master of Social Work degree. In September of 2020, Jessica transitioned to the role of Social Worker 2, clinical trainee on the therapeutic services team. She is now providing therapy and skills services to families. This month, she will begin the process to become a nationally certified trauma-focused cognitive behavior therapist. Now we finally get to the point about the nomination. Our nomination was a family that Jessica has worked with. Jessica's nominator states, "Everything Jessica has done for us is a big reason why my son and I are in a much better place. Jessica digs deep to help us in any way she can and checks up on us to make sure we are okay. This girl has been there for us. She took over for Taryn and blended in with my family perfectly, just like Taryn did," and there are 5 exclamation marks. "These girls are there for my son and I through thick and thin. I love them like family." So thank you, Jessica, and congratulations on being our HHS March Employee of the Month.
Thank you.
Thank you.
It is
Thank you.
nice to have nominations outside of the employees. We honor internal nominations just as well, but it's so nice to hear the clients have great things to say about wonderful employees like yourself.
Yeah.
So thank you
Thank
for
you.
everything you do.
Do you have anything
I
to
agree,
say?
and just going from an intern in 2016 to being hired as a social worker, completing her work, and now she was, I believe, our second social worker 2 position hired. So she has, achieved great things in the short time that she's been here. So we're very happy to have her as our Employee of the Month.
And
Thanks,
so
Jessica.
she's out at.
She is out at the HSC. I don't even know if I haven't seen her around lately. I think, are you working from home right now, Jessica?
Yeah, majority of the time
So
I've
we'll
been
see what
working
March
from home.
brings on whether you'll need the parking spot out at the HSC or not. So
Yeah.
time will tell.
Yes.
Well, thank you for everything you've done or are doing.
Yeah, thank you.
So moving forward here, we're on to the regular agenda. The first item on the regular agenda is the presentation of the 2021 Mental Health Advisory Council Unmet Needs Report, which I appreciate sending that out. I think it was probably like 3-4 weeks ago in an email. It's always fun to, I shouldn't say fun, because it's interesting.
Right, and we have with us today Eric Nagel. He is the chair, I believe, on our Mental Health Advisory Committee. He works for Wright County Community Action, and he'll be presenting the Unmet Needs Report. And I don't have the statutory number here, but for the benefit of our new commissioners, annually it's a statutory requirement that we present the board, the Health and Human, I think this is in the relationship as the Health and Human Services Board versus the Health Board. Identified areas of need in the county and the areas of mental health. And with that, I'll turn it on over to Eric.
Good afternoon, board members and board chair. Well, you introduced the unmet needs report, so I'll just go right from where you left off. It was a busy year despite the pandemic in terms of conversations that we had in our meetings. And I think one of the things that came to light was homelessness was still in question. I know that there's a number of things being done, but the Salvation Army, and this is a list of things that are unmet needs as well as some solutions that were discussed. The Salvation Army program is available 24 hours a day for homeless clients in need of placement. So that's one thing that's out there for a solution. Also, one of our members is from Blue Plus described that they were starting a housing flex fund this spring in April for their members. So there's some things being done. One of the other issues is psych services in the jails. So we know that right now there's telepsych available throughout the county, and that's been more helpful than probably in the past. One of the solutions was DAs for the clients who have lost insurance when they're in jail. So whether they need MA or PMAP or some solution. Transportation is an ongoing concern. Obviously, cost and availability for people who are.
Eric, I'm just going to interrupt you for a second and for again, clarification for the board. DA, I believe, is diagnostic assessment.
Diagnostic assessment, yes. Okay. The transportation obviously is still a concern, but there was a conversation about looking into the Dakota County pilot that they have with Lyft to provide services for people who are needing mental health services. That's ongoing right now. Coordination of services when discharged from a facility or program is still a need that's sometimes unmet. Solutions or success can occur when the case managers follow up with clients. That's the first thing. And also support services to provide follow-up services. So what needs to be done in addition to the case managers? We have had participation from foster parents in the Mental Health Advisory Council. So foster homes for children seems to be a pretty significant need right now. The main need at this time is for CFC providers that will take teens and adolescents. So there seems to be some help for those younger kids, but not so much for the older kids. And then obviously the high needs children, there's clearly not enough foster or therapy care for those individuals as well, which can lead to stress for the parents and also for the children. Staffing concerns in corporate foster care homes, there was a conversation and mentioned that individuals are basically understaffed, and so they're having to work extra hours, and it creates a stressful staffing pattern for the people within that care provider scenario. We also talked about the need for more frequent opportunities to train the community on mental health concerns. There are some, but a lot of them have been tabled because of the pandemic. Doing face-to-face trainings has been very difficult to do. We've also found that more services are needed for the elderly citizens facing their health concerns. This pandemic's been really tough on older adults. The social isolation, it's caused a lot of them to need services, and it's difficult for many of them to know how to obtain services. Mental health, first aid training was something we've discussed quite a few times, and we're hopeful that we can get that to happen for non-provider county members, so people who are not associated necessarily with the county, to get that kind of training. Mental health service models are built for in-person sessions, so it's been difficult to do these kinds of tasks virtually. That's another concern that was raised. One of the things that came out of a conversation at our last meeting was the potential for us to shore up food security. So there was a brief discussion on a coalition of food shelves and how we might actually build a mobile food shelf model to get food to those individuals who maybe can't go out, whether it's a single mom or an older adult or someone with a disability. Medicare recipients is an ongoing conversation. That's something that's being talked about at the highest levels of government. Obviously, they're trying to figure out how to best deal with finding providers for mental health services. Once somebody gets into a Medicare plan, it's difficult for them to oftentimes find someone in their network that can provide services within Wright County. That's not a problem that's new. It's been going on for years. And then the last one on the list here is community members and clients are unaware of case management options through their insurance companies. So there's a lack of maybe education for individuals within the community on how to access those kinds of mental health resources through their insurer. And that topic of conversation came directly from the insurers. So we know that it's an issue, and obviously there's a need to figure out how to deal with that. So that's our list. If you have any questions, I'm happy to address any of those issues.
So I'm assuming these aren't in any kind of priority level.
I don't think that there's a real focus on priority at this point, but I do think that there are some obvious winners in terms of priority. One of them is the foster care situation, and I would say that the other one is probably the issue with teleservices and getting people connected through telepsych services in the county, how to access that.
And I'm glad to see that the clients and community members are unaware of their case management options through their insurance companies. I think the complexity of coverage for mental health services with your private insurance is, most people just don't utilize it for the fact that they don't know what the coverage is.
Right.
We need to do better as a community in educating people of that, so they are seeking the services when they need them before it becomes a crisis level. The other side of it, I've talked to a few different individuals they're involved in the pilot program in Dakota County with Lyft and Uber. Very successful program. The individuals I talked to about it, that until more counties get on this pilot program, because then it will create a greater demand for Uber and Lyft drivers in the community. But right now with their pilot program, because there's not enough counties utilizing it, and because people, for whatever reason, I'm still trying to understand the complexities, where they could be on the pilot program in Dakota County but live here, but because we don't offer that program, they don't have enough Uber and Lyft drivers because there's not the demand out there. So it really needs more of a regional effort for it to have some economy of scale.
And I would agree. I would just put I think and I agree with Eric's assessment as well, as where some of those priorities are. That transportation piece, I think, as you know, we're one of 4 counties that got the $5 million to build the urgent mental health center in St. Cloud. So one of my concerns is, how are we going to get people from Wright County, whether it's Cokato or Monticello, and get them to be able to use that facility that we're partial owners of, basically. I don't know if owner is the right word. So I think it'd be really behoove us to try to figure this out before it opens later this year.
And especially because if we can do it with a Uber Lyft program,
Absolutely.
It makes it more of an on-demand, and it makes it outside of just a bookend of 6 a.m. to 6 p.m. because a lot of people like it for the fact that it helps them for the sanity levels of them being able to get to and from church, to go and to and from social gatherings on weekends, which is huge for people that are struggling with mental health issues. So.
And Mr. Chair, I think that this will help because, people have been looking for Uber to really take hold in Wright County for years. And so Uber or Lyft, and I've seen an occasional, tag on someone's door, Lyft and Uber, but not that many. So.
No, and I would say if you're looking at, paying a Health and Human Services staff and their time and mileage, or sometimes law enforcement staff, their time and mileage,
Right.
It doesn't make sense, and it doesn't, fill the void. And I thought when that Dakota Lyft program was raised, I thought it was solely Dakota County. So this is the first I'm hearing that they're kind of spreading their wings a little bit into other counties.
Well, I think it still is just Dakota County, but there's
County,
individuals that are on that program that live out. I don't know how you know better than I do on how they can get their services through a county that they lived and maybe moved, and then they. I'm hoping that the state is going to open that program up here at some point, because this is going on like 2, maybe going on
I don't
the
know if
third
the
year.
state will be at the forefront, so I think we're kind of more on our own.
I think when we looked into this in the past, we got a grant from Alina that we tried to use for a similar purpose. I think the issues we ran into were liability and how to pay, where how does it become Wright County dollars versus client dollars? Clients don't always have the ability to pay. If it's our dollars, that makes us potentially liable, and these folks through Uber and Lyft don't necessarily have background studies done, and there's not an insurance backing. So I think we've hit some of those kind of red tape issues with looked into it in the past.
Yeah, and I guess I think because Dakota County, because we use a third-party payer for that, where Dakota County does direct pay. That's one issue there. I'm not quite sure how they overcame the insurance barrier to it, because I'm guessing that MCIT isn't covering the liability on a non-employed driver, so I'm not quite sure how they.
Yeah, get around that.
Yeah.
So it has been an option that we've been looking at for the last year, trying to figure out how do we dance our way around that and still make it a safe opportunity for Ray County and our people that we're serving. Get from plan A to plan B.
And I also wanted to circle back to the foster care. Just a couple of things. It talks about teens here, but really teen boys is where our crisis need for homes right now kind of resides, is with the teen boys. And also, if you can imagine, just the toll on foster care parents during the pandemic when these kids that would typically be going off to school and now they basically have the kids full-time at home. A lot of these kids have very high behaviors. And I think we've done a good job at least trying to maintain our pool of foster care providers because we're always looking for more providers. But I think we're in a fairly solid place overall just with these couple of areas of need that were identified.
Commissioner Dolan.
Yeah, just curious on what kind of cost was involved in that. Do you know?
Cost for?
To use the Lyft drivers, were they just paying them the standard rates or what?
It was standard rates. It was standardly if you got a ride, but the only difference is that we're using waiver dollars to pay for it. So that's.
Or another source.
Or another source,
Any
or whatever,
yeah.
whatever it could be. Yeah.
Right.
Okay.
And then just a reminder that we do have an adult mental health outreach worker, and that position is currently vacant. But when we talk about getting the word out about potentially, and I'm looking at Jill because it would report to her, potentially we could do something internal to help with that case management piece with insurance. If that person's working with individuals that have insurance, can maybe help navigate them through that process.
And I think our integrated services, I believe later comments for folks that are calling in that are on a PMAP looking for services, they'll be able to hopefully do that initially. Battle some of that to get that information a little more quickly to clients when they first call in.
Thank you.
Thank you. So,
Thank you, Eric.
Thank you.
all right, well, I appreciate, I guess,
Appreciate the update.
I guess we do have to take any action to approve or to basically recognize that we were given this.
I think a motion to accept the unmet needs documentation would be appropriate.
That's what I would say. Good. All right.
I will make that motion.
All right. Thank you, Commissioner Hewsome.
I'll second that.
Yeah, second by Commissioner Ketchmark. Any further discussion?
Yeah, what are the new commissioners? How are they going to help us solve it?
Yep.
What do you think?
We'll wrap it up by the end of the year.
Commissioner Ketchmark and Commissioner Wetter are tasked with solving all these issues within the next 12 months.
I'll have to say, all the years that I've been here and seeing this documentation, the list has never gotten shorter. I think we have filled in gaps, but I think the list keeps staying the same length.
Yeah.
I really hope we can avoid from having to use in the foster care going into the group type settings because
Absolutely.
that was the way it was years and years ago, and that was not the way it should be. And I hate.
We're making good
unfortunately-
inroads.
Yes. So with that, we have a motion. We have a second. Any further discussion? Hearing none. Commissioner Dahlin?
Aye.
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 All right.
Thank you, Board.
Hey.
I believe our next two presenters are both online virtually. We have Joel Torkelson and Ellie Vanas, and they have a COVID-19 vaccination update.
All right.
Hi all, this is Ellie. I am one of our public information officers for our COVID response. Joel is also on here somewhere as well. We're just here to give a quick update about how our vaccination process has been going. As of last week Friday, we have given 1,570 doses of vaccine. 1,400 of those are first doses, 170 are second doses. This week we have a second dose clinic tomorrow evening and a first dose clinic on Thursday. We're going to continue with a kind of a Tuesday, Thursday system for the time being. That's about the amount of vaccine we get. That allows us to do second doses on Tuesdays and first doses usually on Thursdays. I would like to extend an invite to anyone on our board. If you would like to come to clinic, you're more than welcome. It's at the Highway building. We're able to do an entirely drive-through clinic. It's actually a really cool system. We have some people visiting our clinic from other counties too, wondering how we're operating it. We've gotten really great compliments from a lot of the people that go through, so we're pretty proud of how it's operating right now. Just to give a little rundown on how we get our vaccine. I included this in our situation report last week, but I'll give another rundown today. On Wednesdays and probably now Tuesdays, we request an amount of vaccine from the Minnesota Department of Health. That amount was what we will be using the following week. On Friday afternoon or Friday evening, the Minnesota Department of Health tells us how many doses we will receive. Thus far, what we get from MDH has been less than what we request. We usually receive our vaccine shipments on Tuesday and have 72 hours to use at least 90% of our shipment. We have been able to keep up with that and actually usually use 100% of our shipment within that 72-hour time period. This process is for first doses only. Second doses are just sent to us automatically based on how many first doses we provide, so that system's a little bit different. It's still an extremely limited amount of vaccine. We're actually still working to finish priority group 1A, so those healthcare workers and people who live in congregate care settings. So we've been able to vaccinate very few people in the next phase, which is those 65 and older school staff, childcare workers. We do have clinic this week will be half people in priority group 1A and half people in 1B. We have a 65 plus random selection list, and when we have vaccine available, we will randomly select however many appointments are available. People from that list will then get contacted to make an appointment. It's pretty slim vaccine all around. Fortunately, local healthcare organizations are starting to vaccinate their patients who are eligible older adults. So when they have vaccine available, they contact directly their patients to get them scheduled for an appointment. Our partnership with healthcare providers has really improved over the last few weeks. We now have weekly meetings with them where we go over kind of game plans, how much vaccine we're getting, people we're able to vaccinate. It's been going really well. We have our next meeting with them this week, Wednesday. Our partnership with the highway building, the highway department for use of their building for clinic has been going really well. And the sheriff's office has also been a really great partner, providing some staff for security purposes as well as even directing traffic. So we're very happy with our partnerships and how they've been going. Kind of just waiting on more vaccines seems to be the story for us and everyone in Wright County right now. Does anyone have any questions I can answer?
Any questions? Yes, Mr. Wetter.
You said that the vaccine is given at the highway building, and I was wondering what hours are they usually, from when to when?
It depends on how much vaccine we get. We right now, for first doses, are doing 7 a.m. to 7:30 p.m.
And Ellie, can you explain the acuity scheduling system about how people then sign up for those doses?
Yep. So we have, we're using Acuity, which is an online system to help us schedule our clinics. And so people who are eligible get a link to sign up for it, and then they fill out their information, and it automatically books them an appointment in our system. It sends a confirmation email to them, and then when it's their time on the day of vaccine clinic, they pull up to the big doors and they get pushed through our drive-through.
There's, I've got, went to a couple tours of the government center this week, so there is literally a huge arrow that points people into the path to follow. And my understanding after listening at a few safe school meetings, not everybody is intent on following the correct path, but eventually they find their way to the right bay where they get their shots. So it's an interesting process.
Yeah.
Very good.
We're learning as we go.
Yes, Commissioner Wetter.
Have you been getting a lot of calls from people asking, what to do? I want my, vaccine and that, because I'm getting deluged, people have been asking me, and I know my older children have been on me, and I am registered too, but as well as my husband. So I was just curious, how many calls and stuff a day maybe you get?
We get 30 to 40 calls a day to our information line staff. The large majority of them are people calling about vaccine. So either it's people who are in 1A that we have not gotten to yet, or it's usually people who are 65 and older, or the children of people who are 65 and older wondering how to get themselves, their parents vaccinated.
So what happens if they don't have access to online, internet, to get on to registered? Is there another method for them to, register?
Yes. Mm-hmm. Yep. So if they don't have access to, if they want to get on like our 65 plus random selection list or our 1A wait list, they can call us, and then we have our staff directly input them into that list. And then when we have clinic open, we do have people that are calling those without email addresses.
So if you would go to our Wright County website page in Health and Human Services and the COVID page, there's a COVID page right off of the county page. I believe it's both places. They can get the phone number. Well, if they don't have access, I guess, to a computer, that might be problematic as well.
Our phone number, we also have been sharing it on places like KRWC, in newspapers, other things like that, to try to reach people kind of where they're at rather than only advertising online.
Thank you.
Thank you.
It's amazing, they fill up very quickly, the clinics, so it's, we don't have a bunch of open spots that we're worried about very often.
Yeah.
Very good.
Thank you, Ellie.
Thank you.
Thank you.
So that was informational only. We're kind of moving on. We are going to do the update with the case banking and financial services. Kim? Or Michelle?
I'm actually going to let my supervisors, who are actually doing the good work, here's Stephanie and Michelle.
Morning, everybody.
Hello.
Thank you for having us today. I'm Michelle Zach, one of the financial assistant supervisors, and I'm going to walk you through kind of the background of us making this decision to move our adult and family units to Case Bank, and then I'm going to turn it over to Stephanie, and she's going to go through some of the positive reasons that we would want to do Case Bank. So late last fall, we started doing some discussions in our units looking at, we've got a lot of big changes coming up. We've got the phone system coming that's new. We've got the new building. So we just wanted to look at how we're delivering services and where we can improve our services for our clients and where we can make things, nicer for our staff and go from there. So with these discussions that we had last fall, we decided that the big takeaway is that we wanted to switch our adult and family unit to Case Bank. We have a long-term care unit that we switched to Case Bank about 2 years ago, and it's been going really well. We use that unit as a let's try this one first. Let's see how it goes so that we have something to measure to see if this is a path that we wanted to take with our other units. So what Case Bank means is prior to the change of Case Bank, all of our workers had their own individualized caseload. So each client was assigned a worker. That worker was the one that would take care of their cases, get everything done for them. With moving to Case Bank, instead of having your own individualized worker, we have a team of workers that work on a collaborative group of cases. So that's kind of the big switch that we did. In order to make this change, what we did is we put together a committee. In the group, we had adult, family, long-term care workers, as well as our lead eligibility specialist, some office staff, and Stephanie and myself. In this group, we sat down and we looked at all of our current procedures. We looked at a new policy of writing with the Case Bank, and we determined what little tweaks and changes needed to be done to make sure that this would be successful. That team did a great job. They put everything together that we were able to successfully launch the adult and family Case Bank
as well as make some changes to make our long-term care case bank more effective with how it was written. So we're excited to announce last week Monday, so just a week ago was our original launch. The team did a great job. Workers have been coming back with really good questions so that we can look at our processes to see what all still needs to have little tweaks. And as a group, we plan to meet the next year, maybe even longer, on a fairly regular basis so that we can really gauge to see, did the changes we implement make a big difference? How are things better for our clients? And go from there. So now I'm going to turn it over to Stephanie to talk about some of the positive reasons to Case Bank.
Thank you. Yes, as Michelle indicated, we have been working very hard over the past year to incorporate different processes internally to enhance our customer service. So that is the ultimate goal here, is that we want to increase our level of customer service to the residents of Wright County. With that being said, moving forward with case banking does allow that to happen. So instead of having just one worker assigned to an individual, we now have 7 people that could assist an individual, or in our adult unit, we could have 6 people that could assist them. So it has really moved us forward in that direction to allow us to meet that goal. Ultimately, what that means is providing a consistent level of customer service for everyone, also having a no impact or a negative impact if a worker is out for the day. So if you had one worker and they called and they weren't here, you'd get handed off to someone and they may or may not be privy to the information or help us with our integrated service way of thinking of having them not have to tell their story over and over again. So if you have a case banking situation, anyone who answers that phone will be willing and able to assist that individual. Furthermore, it helps with our workload management. So we will be able to improve and gain efficiencies going forward. Ultimately, what that has done, we have 3 OT staff currently that have managed, give or take, 36 calendars on a day-to-day basis. Going forward, we now have 3. So we have a calendar for adults, we have a calendar for family, and then 1 calendar for LTC. So it really has maintained and improved their area of being able to schedule clients efficiently and with the correct person. So another positive effect for us going forward. Another issue is we will be able to improve our performance measurements. So with that, we will be able to quickly identify training needs, both internally within amongst the groups or just within individual peoples. So that is ultimately what we'd like to see, more eyes on cases to identify prone areas of errors or just enhance our knowledge across the line so that anyone who's answering that question can assist that worker or that client. Also, we have a lot of new staff, as you know, with introductions over the past year. So just being able to expose them to programs will allow them to increase their knowledge to help any client that may come through our doors. Lastly, one of the things that is going to improve is just the work-life balance for our staff. So being able to give them the balance when they are on vacation to truly be on vacation. No longer worrying about all the phone calls or the documents that are piling up on their desk when they are on vacation. Thank you. If you have any questions, we are open.
I think it's just a great idea. I really do. I mean, you can really see how it increases efficiencies, and we all get the phone calls, my worker hasn't gotten back to me and blah, blah, blah. Well, I mean, they're maybe on vacation, they maybe been sick for a day or 2, or they're just overloaded and can't get to that back to that person, and so I think this is really increases efficiency. I think it's great.
So what are you going to do without all those work log spreadsheets?
And the other side of what Commissioner Houston was talking about too is when you come back from a vacation and you have a caseload of 300 people, it takes you 3 weeks to catch up. Well, now you come back and your plate's as clean as can be because everybody is, it's kind of gone on without you throughout the process. So we're going to keep eyes on it. We want to be sensitive to the fact that some people like having their own case manager. But I think overwhelmingly what we found with the long-term care case bank is that people really liked it because they got an answer right away. Our call responses are close to 100% a lot of times, so people get through 100% versus, if your worker's just on break, you're not going to find them at their phone necessarily. So we're very excited.
Now we just need to get this system to integrate with the state systems and allow clients to upload their documents right into the system for us. Then we'd be set.
Can we fix the state document?
Yeah. Mr. Chair?
Yes.
So if somebody calls in now and they're a client and somebody's on vacation, you can't key in their name and get case notes as to where the status is and what the correspondence has been to this point?
You can, however, they're doing backup. They have their own caseload, so basically they're doing backup for whoever is out at that time. And so they can see that with OnBase, they can see what the case notes are. I would say that it's a lot of people are either reticent to share out their information because you don't want to tell your whole story again to yet another person. And I think just sometimes it's hard to put the pieces together. So a lot of times they will elect to wait for that worker to come back. But they do have access to the case notes and everything right now.
Okay, thank you.
I guess the one thing to say is a lot of these people have very, very complex living situations, which makes collecting, especially financial information, very, very challenging. And if you don't know them on an intimate level of who lives in the house, who doesn't live in the house, and yeah, I can imagine.
Yeah, thank you very much.
And this allows us to process work too, so people can be doing one thing and just get more of it done, like behind the scenes. A lot of it is the processing, and that frees up other people to be answering the phone calls and things like that. So, and a lot of credit to Michelle and Stephanie for pulling it all together. We kind of gave them a short time frame, and they managed to pull it off. So very nice work.
A lot of credit to the team that was
Absolutely.
put together. They did a wonderful job getting it all put together.
We're getting so tech savvy around here.
I know.
Commissioner Wetter?
Well, I was just going to ask, who thought of this and brought that idea together? Somebody had to have been and kind of brought it forward.
So a lot of counties have implemented different setups for Case Bank. So every county is set up just a little bit different. So the thought process of Case Bank has been around for quite a while.
Okay.
It's just we kind of took it and, okay, how is our stuff set up at Wright County and how can we implement something with the number of workers we have, the number of cases?
I think, and I think the impetus then was knowing that at the end of March, we're going to have the new contact center. So the impetus was if we got this in place first, as we move into the contact center, everything will be ready to go and hopefully seamless to have those calls kind of fall naturally. We're going to have a much greater latitude in directing calls and, getting them to the person that can answer. So we just wanted it to be being ready in advance.
Yeah, it's a very good idea. That's why
I think it'll be
thought,
fantastic. Yep.
Thank you. Thank you, everybody.
Thank you.
Thank you.
So moving on here, we're getting information from the HHS Advisory Committee meeting.
And board, just for the, I just lost it. Just in the interest of time, you have the minutes from our last HHS Advisory Committee. I wasn't there, however, Commissioner Hewson was there. We did not have a quorum. We went through our updates from the Mental Health and the Public Health Task Force committees, the open forum. We discussed our 2020 engagement survey, which we've shared with this board already, and our updated HHS projects, which we just talked about, the contact center and what that's looking like, and the integrated services, which I might spend a couple minutes on during the director's comments. And I don't know if Commissioner Hewson has anything to add.
I had kind of touched on a couple of things last at our board meeting, just the fact that we didn't have a forum and about the unmet needs, and so just a little information, like you said.
We met, we'll meet again, yep.
Yeah, it was.
Well, then no action needed, that's just informational. We'll move on to the administration in the fourth quarter financial report. Christine.
And we understand that this is probably a lot of information for our new commissioners, and Christine, I'm sure, will be able to answer your questions and deliver it in a very succinct way, as she is wont to do.
It's going to take a second to share my screen so that those online can also see it. Okay, good afternoon, commissioners, and for those of you that are new, I will pick a few things to point out about the financial statements without trying to give you 30 pages of information all at one time. The Health and Human Service budget is very complex, and you will learn over your next 4 years or for however long you're with us, how each of the different things interrelate. Each month we put together this financial service packet. We do come to the board each quarter with this packet and also our dashboard graphs, which I will show later. The top page is our summary page. It basically summarizes the 700 lines of our budget into one easy-to-read document. Object code is going to be the last 4 digits of the chart of account. You'll see that later on, and I think you'll get more information on that tomorrow during the board workshop. 2019 actual, so that was all of our expenditures through 2019, and percentage of budget is of the 2019 budget. The 2020 actual, which is the gray column, that's going to be all of our expenditures for calendar year 2020 at this point in the year. Next is also the percentage of the 2020 budget. The difference shows the difference between 2019 actuals and 2020 actuals, as well as the increase from the prior year. And then the last two are what the 2019 budget and the 2020 budget. At the top of the chart, you'll see current percentage of the year. Right now it's at 100% because we've completed all 12 months, and that will be used to compare the percentages that show on each particular line later in the documents. So for 2020, we were at 98% of our revenues, and that's going to be this percentage right here. That does include $1.3 million in transfers in for the class and comp and the open ASME union contract. That was held in Fund 100, and then once that contract was closed, it was transferred from theirs into ours. We received the revenue as a transfer in, and the increases to salary goes to the budget. So the budget is reflected in both of those areas. We also do get a transfer in for capital improvement projects. We run them through Health and Human Services because there is some reimbursement. They are budgeted in capital improvement because they don't necessarily close within 1 year, and then the funds are transferred from CIP into Health and Human Services.
So for example, when we purchased the contact center, I think it was upwards of $400,000. For the portion of that project that goes toward like financial services, we can be reimbursed for like 50% based on our reimbursements. So it behooves the county for us to run it through our HHS because we can then access some of these reimbursement streams through state and federal dollars.
I do want to just clarify is that right now these are preliminary statements. We do a very thorough review. Sometimes we identify revenues or expenditures that need to be moved to a different object code. And so you will end up with a complete audited financial set of statements June or July of this year after it goes through the entire process. But these are, you're not going to see significant changes necessarily from what we present today.
And the $2 million?
Yep.
Okay.
Not down to my notes yet.
Oh, sorry.
So expenditures are at 95%. Personnel is all of your salary and fringe. So that was at 96%. Administrative is really types of expenditures that aren't salary and fringe, and they're not client related. So that's going to be your building rent, your liability insurance, your travel expenses, training. All of that falls in that administrative category. That's at 102%. And then program is at 90%. So that's going to be purchase services for social services. It's going to be cost-effective medical insurance for financial services, or any direct client information or services we provide through public health. We are waiting still for almost $2.1 million. Our CARES Act funding expenditures are included in these numbers, but we have not received the transfer in to cover those expenditures. So actually our transfer in line is going to be significantly higher. I'm not sure if that's going to be processed as December 31st of 2020, or if we'll see that in our 2021 financial statements. Any particular questions on this first page? Okay.
Good.
So then the next document is going to be summarized but detailed for the lines listed here. So on page 2, you'll see the heading at the top left says federal, and then it lists every single type of federal revenue we received in Health and Human Services. Some of these federal grants have pieces in social services and financial services and public health. So that doesn't break down here. This is just for that particular type of revenue. On the far right, you'll see a percentage of budget, and just for example, the very first line is 392% of budget. When we know that it's 100% of the year, meaning it's 12 months, 392 says we are way over budget in that particular area. Those are some good things for you to look at before the meeting and then bring specific questions to me. In this particular case, I know that one because that one has a state and federal portion, and we received the majority of the revenue through the federal source and not the state source. I think for this first time around with the financial statements, I won't go through each of those individual lines, but if you have specific questions, I'm here to answer them. Or you're welcome to give me a call at any time, because you'll see it's page after page of information.
As you say, it's a very complex budget you have.
Yes. So after you get through the first 9 pages, the way our financial reporting system works is that these are individual reports. So we've corrected the page numbers up at the top so that it's easier for you to ask during these meetings on page 9 or page 10. This is what we're looking at. This is where the detail of each particular department is held. So on page 10, you'll see the first chart of accounts, which is this segment on the left-hand side. We've got Fund 11, then it says Department 420, and then the object code is that 5001. That's the one that aligns with this column up here. That happens to be property tax. So then there's pages of pages of, this is the level that we budget down to, is those specific lines for each different area within Health and Human Services. 11,430, and I won't quiz you on this, you'll get to know it, is social services. 11,450 is public health, and then 11,480 is administration. So we've got 4 main areas in our particular budget. After that, starting, you'll see there's a lot of pages of that.
Hey, Christine, while you were kind of pulling through that, I'm guessing that where we ran like hugely over on the computer and software was laptop purchases for remote learning. I'm assuming.
Nope.
No?
We
Okay.
already
Just
have Human Services
we already
was
have
all set up
laptops.
with laptops.
because I'm trying to figure out what the 88, because we're about 88,000 over. Just curious. That's the 6620.
So 6620 is going to be the contact center purchase. So that one was not budgeted.
Okay.
So it was in relation to the CARES Act.
CARES Act money. That's what I was assuming, that's where we're coming back and why that went so far over, but, yep.
No, we were actually very well situated. We were wanting to have the virtual, ability to work from home long before the pandemic, so we were very well situated when it came along. We all had, with maybe just a couple that didn't have laptops.
That worked out really sweetly.
It really did.
If you make it all the way to page 40, there's a treasurer's cash balance. I don't generally cover this. It just basically reflects the cash in each of the different areas of Health and Human Services. And then finally on page 42 and 43 is going to be our capital improvement projects. It shows them specifically pulled out instead of part of the large 40-page document. So that's the majority of this. Is there any from from the commissioners that have been here a while, is there anything in particular that you'd want to ask questions on before I move on to the dashboard graphs?
Nope.
Mr. Chair.
Yes. Yeah.
As a new commissioner, I'm looking at these numbers. How do I know whether there was still more state money coming or more federal money, or whether it's the county that's put in that money? You know, I'm confused at all these numbers and where it would,
So,
you know, when you look at it, you know, where the money's all coming from.
so if you're looking at it here, if you want to look at how much of the Health and Human Services, right here, property tax, this is the revenue. So this is how much money the taxpayers of Wright County are paying in Health and Human Services. See right there, property tax? In 2020, we actually, the taxpayers are on the hook for about just shy of $11 million
Okay.
of Health and Human, of the $29 million that Health and Human Services operates. 10.8 million of it is property tax assessed. So then
But what about the individual departments, so we would know
Like, what do you mean?
where we maybe should giving them more in areas?
So
and-
so within Health and Human Services, you're talking about where individualized comes
Yeah,
out? So
yeah.
now you're gonna break it down into these areas here. So now you look at the revenue streams here. So, right here, you're looking at financial services, and right here comes all your Fed grants, here's all your state grants, and then when you come down here, it'll keep going, it'll show you where the property tax comes in here. So, no,
So
other
like,
revenues.
like indigent county burials is all county money, so it's like $50,000 that the county pays
This
for.
is the county, these are county programming, contributions, so in all your revenue lines, it'll show you where the, and then there'll be a line that kind of shows the income for the taxpayer dollars, the property tax aspect of it. And that'll be
I'm gonna
broken
have
into
to
public
study
health,
this.
it'll be broken down into financial services, and it'll be broken down into social services. But Mary, I'm happy to sit down with
I'm
you.
gonna have to study it more than what at first I just looked at all these numbers and I went, whoosh, you know. I have some experience in these type of things, but this was for me
Yeah, I
overwhelming.
mean, we know where the money is coming from for each of these. I think it'd be hard to decipher on a single line here, you know, like, because like against one expense, we could have three different, we could have a grant and state and federal funding coming in to reimburse that.
Yeah,
So
that's
putting
what
that
I'm-
together would make it difficult.
Because I want to have a discussion a little bit about when we bring the CARES fund, we transfer in that roughly $2.1 million into Health and Human Services for that back. Now that will generate a fund balance within Health and Human Services.
Yep.
And the
Which
question
it
is
should,
like,
because-
traditionally, that fund balance goes to
Health
our
and Human
reserve account
Services.
within Health and Human Services. But, I mean, putting 2.1
A deal's a
in there,
deal.
we're increasing
A deal's a
that
deal,
fund balance by
Commissioner
almost
Batch.
20%.
But see, we paid for those expenditures out of Health and Human Service, so right now.
So you
we are
paid them
sitting
out of
at a
reserves?
deficit.
You diluted reserve, okay, so you're just reimbursing, so we're not growing the reserve by 20%?
No.
Okay, that's all I wanted to make sure.
Yep.
Just because on paper right now, it looks like because it didn't show the transfer of reserve funds to pay for it,
Okay.
it didn't show that, so,
I see what you're saying.
okay. So
And we're the only department that does it that way because all of the other CARES Act funding went through the Fund 100.
Okay, yep. That makes sense then, yep.
Okay.
But we will be still putting, no, actually, we're diluting down our reserves by 51,000 then, because our expenditures were 51,000 over revenue, correct? When I look at it, the total there, it will be diluting reserves by 51,000. 983.
What line, Derek?
The difference on the very top cover, because if I'm reading it right,
Very top.
our revenues minus our expenditures were essentially 51,000 over, right?
735,000.
Yeah, that's what I've got.
Oh, I'm sorry, I looked at the wrong line. Yep, you're right, 735.
So the 51 is only the difference between 2019 and 2020.
Yep, looking at it from afar, yep.
So that difference will be,
So we're increasing our fund balance by 735,000.
we are already, based on what's already been reported, yes, our fund balance has increased by 735,000. we should see another 2 million there.
Yes, but that's replanning money that we've already taken out to pay for these things already, yep, so. But we're only increasing the fund balance by 735, that's all I'm.
And one of the things you'll hear in the financial statement presentation by the auditors is that the state has established fund balance guidelines. Health and Human Services has traditionally trended under the general requirements of, I think it's 4 or 6 months of expenditures. But county-wide, our fund balance has been high enough that it's not been a concern. So it's okay that we've underspent in Health and Human Services for 2020, which is why our fund balance has increased slightly, because we are not, at this point, exceeding the threshold of their recommendation.
Okay, that makes sense.
Okay, excellent questions. So Health and Human Services has areas that we talk about each quarter as our targeted areas. They make the biggest impact on our revenues. IMRMS is the Income Maintenance Random Moment Time Study. So this is financial services. Financial workers, case aides participate in a time study where they get an email and says, what are you working on right this second? And the staff have to select an activity and an activity code, and that is what determines what type of federal reimbursement we get back, if any. So this is where Jamie was talking about we get almost 50% back. Our averages are about 52%. So for each financial service expenditure, we get about 50 to 52% of that back at the end of the quarter. So for 2020, we were at 3.02 million. Our budget was 3.4. What's changed is our expenditures were not as high as we anticipated. So the year before it was 5.7. This year it's 5.77, so they didn't increase very much. Our reimbursement percentage dropped slightly. For the previous 4 quarters, it was at 53.6%. For this last set of 4 quarters, it's 52%. So that change in that 1.6% put us at $92,000 less in revenue. So just to give you an idea of the scope of that little percent change. What we've been working on is the state released new guidelines and new training April 1st of 2020. And we've seen drops both in income maintenance and in social service time study on our reimbursement rate. So we've been working with the supervisors in both areas to identify, did the new instructions provided by the state eliminate some of our reimbursement, or was it COVID and the change in activities and responsibilities what influenced it? And it's really, of course, they occurred nearly exactly at the same time, so it's been a little bit hard to separate, but we've been monitoring this each of the quarters, and now we're really digging into the data to make sure that staff are selecting the right codes on and actually reporting the activities that they work on. Because sometimes what we see is it's really easy if you get an email to answer code 69, which means I'm on lunch break or something else, which ends up hurting us if you were really working on a reimbursable activity and just didn't want to take the time to figure out what that code was, because now we've lost revenue. So that's what our supervisors are working through, and we'll see how that pans out over the next year. So that's the income maintenance random moment time study. The next one is going to be the social service time study. That one is at 2.09 million for 2020. Similar situation, social service expenditures increased about 1.2 million compared to the last year. However, our revenue actually dropped. So we were at 18.9%, and now we are at 17.1%. So that change dropped about $220,000 in revenue. The differences between the two time studies is that We are a standalone county for financial services. Our financial workers get about 30 to 40 random moments per quarter that they have to answer. Social services is part of the statewide pool. Social workers only get 5. So if they're on vacation for one of the 5, we've automatically lost any revenue. But I mean, we suggest that they can only take vacation when they know they're not going to get a random moment, but that's not gone over very well. But what happens in all of the rest of the state of Minnesota impacts our social service time study. So we're not necessarily in as much control of this one as we are with income maintenance. I mean, we've got full ownership in the success of income maintenance because we are, it's only Wright County that's guiding that one. So what I'm showing you on the screen right now is a product called Clear Impact that we use for reporting. You can see the trends over here on the right-hand side. So the down red arrow indicates that for this time period, it dropped from the prior time period. Before that, it had gone up. Any questions on social service time study? All right. The next category then is targeted case management. So for children that have, children or adults that have gone through assessment and have been assigned a social worker, so they're receiving case management services, in most cases they're eligible for what's considered targeted case management. The exception to that is if they're in the DD area, then we bill waiver dollars for that. The piece that I handed out earlier today is a reflection of our rates, and this is important for commissioners to understand, is that Wright County typically is lower than the top 10 counties in the state. So Wright County is number 10 in the state, and we are typically lower than their average. In multiple cases, we are actually lower than the statewide average too. So the first one is your child welfare. So this is anybody coming through the child protection area. We are lower than the top 10, but we are higher than the state average. And that is really where a large bulk of our targeted case management occurs. Children's mental health, which is the second graph, we are lower than the top 10 and just barely higher than the state average. You'll see, if you look across the years, that one we fluctuate where sometimes we're not even as high as the state average. In adult mental health, VA stands for vulnerable adult, DD stands for developmental disabilities. It's one rate applies to multiple areas. You'll see we are considerably lower than the top 10 counties, and we also have been lower than the state average. So what drives those targeted case management rates is our total social service costs, the number of children or adults that are receiving case management services, and the time study responses, as well as our Title IV ratio. So you've got all of these little things that one little change can either positively or negatively impact those targeted case management rates. And that is what drives a pretty significant, almost $1.2 million of our revenue.
And the thing to note for the new commissioners is that we run with a very client to staff ratio in comparison. So that's one reason that we're always going to be somewhat on that side. And then, I mean, obviously depends on how our rent and our costs go in. That may increase that number with the new government center, may not. That's something, like you said, one of many factors, so operational cost. But the only one that we have limited control is really the time study piece, and we have control over the Title IV ratio. You guys have tried many times to talk about case loads and case management size. So that's, because there's a sweet spot. You don't want to have too low of a ratio because you're not going to maximize the time study, but then you also don't want to have too high of a ratio of clients to staff for the fact that you're not maximizing the revenue that you could get, and you're also giving poor service in return as well.
And I won't say anything else. There's a lot that goes into the calculations.
Yeah.
Okay. The next area that is a large area of billing service is our waivers. So social services has the largest majority of the waiver billing, and then public health does have some areas too. So this is in that, particularly in the developmental disabilities area where the client is on a waiver and is receiving case management services. They don't do targeted case management. We literally bill MA for the services that they're providing on a per unit basis. The unit kind of varies depending upon the type of service that they get. This is one area that you'll see historically it's been dropping, and then Jill has worked very hard with her supervisors to establish some expectations, and you can see it's had a very positive result for 2020. We've kind of turned that around. The expectations are very reasonable. We took a look at how much staff time do you have during the year, how much do you have for sick and vacation, we took up that chunk. How much time is for training and meetings, we took up that chunk, and so I think it's at 66% of their time? 63. They should be targeting 63% of their work time is billable for case management, and it's made a positive impact.
Yep. And that's just kind of an arbitrary number that we calculated to see what we would need to be on the good side of that ratio.
The next side, the big revenue area is public health revenues. This will include a small portion of waiver. You'll see for 2020, they ended at 1.97 million. I think that's pretty exciting because for 2019, we were at 1.9, and to be at 1.97 when we've had to redirect staff to the COVID response is really pretty incredible. This is reflective of a few different new grants that we received and were able to provide services on. But most of that, like the dental clinic funds, is going to arrive in 2021, so that's not even included. Drug-free communities, that will all arrive in 2021 also. So some of the big grants that we brought in aren't even reflected, and yet we were still able to maintain our revenue as higher than the year before. So.
Yeah, great.
And on an exciting note, we've actually been successful billing the administrative charge for the COVID vaccine. So we are collecting that revenue when insurance is provided. So the last category, and it's the only expense category that we talk about on a regular basis, and it's the out-of-home placements. Last year we ended pretty darn close to the budget at 2.2 million. You'll see if you look back with the child protection changes that occurred, I think in 2015, we saw a spike, and we've been working very hard to bring that back down by finding placements that are the right facility for the services the child or the client needs without being the most and is also the most cost effective. So those are the major revenue and expense areas that we talk about each quarter. Given you a lot of information, is there any other questions that I can answer today? And I promise there's no quiz next quarter.
Good. Thank you, Christine.
Yeah, thank you.
Thank you.
Very good. Well, thank you for updating us and going through all the finances, Christine, and a good, healthy fourth quarter and finishing up the year report. We'll get the final report once the audit is done, but with that, we'll go back to the director's comments.
Yes, and I do have a couple today. Thank you. As you noticed, that we switched to the electronic packets that should look like you get through the county board type of packets. So we have been providing paper packets, and now our packets are electronic. So we talked with Sue Virgin and made that change. So we're hopeful that works well for you. And again, if you have any things, questions, or if you require a paper packet because something didn't, there was a glitch, just let Amy know and we'll make sure that we get it to you.
And we can print whatever, we need to too.
And I think we did keep the paper packets for longer than we should, just because Commissioner Burrell seemed like he really liked the paper packets. So we made this change. We are looking at, in our public health area, we are looking at moving from our two home nursing programs are currently Nurse Family Practitioner and the Healthy Families America, to one program called MESH. And this is to maintain our standards and consistency and to better manage and supervise the people, because running two programs versus running one program, we just see a lot of opportunities that we can obtain going through the one program. So it's still a decision that's being made, but it looks like it's probably a good opportunity. Plus there's costs involved with each of the programs to be part of them. So between training and the cost of training and the cost of having that curriculum, this seems like it might be a better fit for us. Just on a side note, we have found out that UCare, and we're hopeful that the other PMAP insurance companies will follow suit, are increasing our public health nurse home visit reimbursement from like about $140 a visit to $180 a visit. So that's a significant amount that will be in our 2021 budget that wasn't accounted for when we prepared the 2021 budget. I did put in front of each of you a letter of support that we provided. It looks like this. It's a collaboration between Functional Industries, the Central Minnesota Mental Health Center, and Wright County. It's a request, it's an application to receive technical assistance through our IPS, which is the Individual Placement and Support program. So we already work very closely with both Functional Industries and the Mental Health Center. We have a history of working together on some of these IPS types of situations. And this is to support the identified goals of Aspire application, specifically creating a medical benefit covering IPS, building cross-system consensus on the value of employment and the connection between employment and recovery, prioritizing IPS for supporting employment and those with a diagnosis of serious mental illness. And it goes on, it's the last paragraph on the first page and the top paragraph on the second page. But basically, if we were successful in this, it would provide places on the Minnesota Statewide Steering Committee for Diane Erkins. And I think it's valuable for us to have our own homegrown people on these steering committees so our Wright County voice can be heard. So just an FYI that was something that I signed and that we're all in agreement with these other agencies that this would be a great fit for us. Just a couple more things, I swear. Oh, also, there is an hour change for our public health nurse. So as Ellie was talking about all the vaccination clinics and things like that, it's hard to run these vaccination clinics, and she said from 7 to 7 with the number of public health nurses. The public health nurses and all the administrative staff that are there taking the insurance information and those kinds of things, everybody kind of gets stressed out and worn down with the schedules that we have. We do have the ability, we have 2 public health nurses that work part-time in our social services area, if you recall, working with our Min-Choice assessment. So I requested and Lee approved a change of hours from one of our public health nurses to work up to 40 hours during this, the pandemic. I kind of just arbitrarily said through May 31st to get us through this hump. That would reduce the amount of overtime that other public health nurses would have to utilize, and I think reduce the stress on the staff. So that's just an internal decision that Lee was supportive, and we're not bypassing the personnel committee. I think this is within his role. It's just an awareness for the board. Next, tomorrow's, I believe it's tomorrow workshop. So we had a WIC that we were wanting to have placed on the workshop, a discussion around women's and infant children's clinic. It's a big discussion, and because of the size of the agenda already at WIC, we did not cancel our second meeting this month, and we'll be having the WIC discussion with this board on February 22nd at our second regularly scheduled Health and Human Services meeting. And along with that, I just had, just so you, the reason why it's kind of, I wouldn't say, well, urgent only in the sense that the WIC grant RFP will be posted on March 1st. The letter of intent, whether to operate the program or not, is due on March 16th. and the WIC grant application is due on April 2nd. This would mean talking like about the WIC program for 2022. So that's what the time frame looks like. So more to come. We're preparing some information for you for the February 22nd Health and Human Services Board meeting. And finally, I wanted just to give you a heads up about the integrated services that you've kind of heard us talking about throughout the day when we introduced Sarah, and then when we were talking about the phone banks. Integrated services is something that we're implementing in Health and Human Services. Again, like some of the other initiatives that we were talking about, other counties are ahead of us, but we thought this was an opportune time going into from 2 lobbies to 1 lobby later this year and going to the contact center. On our SharePoint site, we did create kind of our charter document for our integrated services. So we're not hiring anybody. This is all leveraging our existing staff. Nobody's changing units to fall under somebody else. It's more of an informal team that we're creating to provide a broad and universal intake to assess and determine client needs. So just our goals, which I guess is probably what you'd be most interested in, is to reduce barriers to accessing services, reduce time from referral to application to receiving those services, and increasing the coordination of client access points to promote self-sufficiency. So we're kind of just looking at, we've talked about DHS wants us looking at the whole person, and it's kind of that whole idea that instead of somebody comes in and they say, well, I need health care or I need food support, we're assessing them at that point to see what their actual needs are, so they're not back in 2 weeks later with a big crisis that now, it's going to take all hands on deck to solve. So we're looking at doing a better, more universal intake process and sometimes they're not going to need our services, they're going to need something out in the community. So at that point, we'll pull this team together. There'll be directed calls to to the integrated services team. They'll be responding to our walk-ins when we have more walk-ins. And we feel like this is going to do a much better job at getting our services out to the community. And I think internally it's going to help us a lot too to understand, the right hand doesn't know what the left hand is doing because we're such a big agency and so many different things going on. We're hoping to pull this kind of multi-disciplinary team together so we can better assess when people come in by having different eyes on them, helping them on from the financial standpoint, the mental health standpoint, physical, and then with public health being some more of the proactive types of things. So just something for you to be aware of. And that is all I have.
Great. With that, if there's no other business to bring before the Health and Human Services Board, it's a good meeting. We will adjourn at 3:02.
Thank you.